Some new expert testimony on birth control pills is that they may have dangerous side effects for some women.
A team of doctors here at Johns Hopkins University in Baltimore documented one danger of birth control pills. The government is rushing the findings to physicians and pill makers and is holding a special meeting in Washington tomorrow to discuss the findings. The team, led by Dr. Philip Sartwell, studied the case histories of 350 women and found that those who took the pills had more cases of thromboembolism or blood clots. The doctors reported their findings last summer, but the government is only now taking action.
We feel that somewhere between 4 and 5 times greater risk of thromboembolism exists in a woman who is using oral contraceptives.
Based on what you found out, do you think there should be more restrictions on the use of birth control pills?
I think the pill needs to be looked upon as what it is, a very potent form of medication. This is not something local that's used as a contraceptive or for other purposes. It has a considerable and fairly profound effect on the body's economy. For this reason, it is essential, and I can't stress this too much, that every patient who is using the pill, either for contraceptive purposes or for other purposes, and a great many do use it for other purposes, should be under medical supervision. And medical supervision means regular, periodic visits to the physician, certain examinations which are recommended to make sure that everything is all right.
Well, if you finished your study last year, why is the Food and Drug Administration just now sending it out to doctors and requiring pill makers to put it on their warning labels?
Oh, I think you should ask the Food and Drug Commissioner that. I couldn't answer that.
Some critics say the large drug companies have undue influence on the nation's doctors and the kind of medicines they prescribe. The Senate subcommittee is looking into the issue, and we have a report on that from Eric Ingberg.
At the core of this debate over the influence of drug companies on the medical profession is the question of whether doctors are overprescribing drugs for their patients. Dr. Paul Stoley of Johns Hopkins University's School of Public Health has studied prescription practices.
As you examine drug advertisements, something that I've tried to do over the past 10 years, you can see how for many drugs they've widened the indications for use. A drug is initially marketed with the idea, say, it might treat severe anxiety, and then the advertisements begin to suggest that it might be good on your first week away at college, or if your daughter's getting married, or if you're undergoing some temporary stress.
While there are calls for government action to diminish the influence of the drug companies, the American Medical Association takes the position that more government control over advertising and other material provided to doctors by the companies would amount to censorship over scientific information, and further, that such controls aren't needed.
I think it's impertinent of the FDA and for Senator Nelson to imply that the physicians of this country are so stupid and so uncritical that they will buy without any reservation whatsoever what the advertising industry puts before them.
What is at stake, a senior official of the Food and Drug Administration has said, is nothing less than the integrity of the medical profession. Eric Ingberg, CBS News, New York.
A doctor from Johns Hopkins named Dr. Kerr White proposed today that people be taxed for the harm they do themselves and companies taxed for the harm they do the environment. He would have people taxed on the amount of alcohol they drink, on the tar and nicotine content of the cigarettes they smoke, the junk foods they eat, the soft drinks they put away, and so on. And all that extra tax money would go toward paying the medical costs of poor health brought on by overindulgence.
In the early 50s, the Soviets began beaming microwave radiation at the U.S. Embassy in Moscow. The reason never was clear, possibly to jam embassy eavesdropping devices, but the concern over harmful health effects was very real. Today, a government medical consultant told a Senate subcommittee that concern was for naught. Lem Tucker reports.
Since the microwaving of the American embassy in Moscow was confirmed by the State Department last year, past and present embassy employees have told of suffering strange medical ailments while working there. The fact that 2 past ambassadors died of cancer and a third was reported to be suffering from anemia, and that anti-radiation screens were installed on embassy windows, fueled rumors that the radiation was causing medical problems. The State Department has engaged Johns Hopkins University School of Public Health to recheck the medical records of all past and present employees of the Moscow embassy. Results of that study should be available in early 1978. Lem Tucker, CBS News, Washington.
A Johns Hopkins medical study today released concludes that the Soviet microwave bombardment of the U.S. Embassy in Moscow has not led to a higher than usual incidence of cancer or any other disease in Americans working there. The State Department said it's pleased with the findings, but still wants the Soviets to stop the bombardment, which is presumably a surveillance measure.
A nationwide study by 2 Johns Hopkins School of Public Health sociologists shows increased sexual activity among urban teenage girls, increased interest in preventing unwanted pregnancies, and decreased use of effective contraceptives. The researchers say all of that increased sexual activity since 1976 is attributable to whites. Mariah McLaughlin reports.
Sexual activity among teenage girls in metropolitan areas is on the rise, according to the latest in a series of studies done on teenage sexuality. The 1979 survey shows that 50% of unmarried teenage women have had sex. This compares with 43% in '76 and 30% in 1971. Although the survey indicates that there is an increasing use by teenagers of some form of birth control, pregnancies increased, up to 33% in 1979 as compared with 30% in 1976 and 21% in 1971. And more pregnant teenagers turned to abortion. In 1979, 37% sought abortions. In 1976, only 33% did. Researchers indicated there is no easy solution to the problem.
So many things in our society are pointing in the direction of greater freedom for young people. And one of the byproducts of that, if it's not something more direct, is increased sexual activity.
Researchers refuse to predict a trend. All they will say is that for the teenage woman of today, there is earlier sex, more pregnancies, more abortions, and fewer marriages. Mariah McLaughlin, CBS News, Washington.
Half of the teenaged girls contacted in a recent survey reported they had engaged in sex. Scholars at the Johns Hopkins University, working under a federal grant, have been studying the sexual activities of young people, and Robert Hager has some details from this latest survey.
Angela is 16, in high school, and pregnant. A new report to be published tomorrow says there are more and more teenagers like Angela, that sexual activity among young people continues to increase. Johns Hopkins University doctors Melvin Zelnick and John Kantner surveyed 2,400 teenagers and found, among young women 15 to 19 years old, 50% reported having sexual intercourse. In a similar survey in 1976, the figure was lower, 43% then, and back in 1971, it was 30%. Other findings: fewer use the pill than in previous surveys, more become pregnant, fewer choose marriage, more choose abortion. Finally, young men were surveyed, aged 17 to 21. Of these, 70% reported having intercourse.
So many things in our society are pointing in the direction of greater freedom for young people. And one of the byproducts of that, if it's not something more direct, is increased sexual activity.
Is we have a conflict. People oppose sex education. People say it should be done in the family. The same people who are saying that oftentimes do not talk to their children about sex.
Authors of the report believe schools, parents, or someone must give young people more information on dealing with sex. They don't believe sexual activity among young people is likely to decrease. Robert Hager, NBC News, Washington.
This medical note, more evidence today about positive side effects of birth control pills. A team of researchers at Johns Hopkins University says that for women under 35 who do not smoke, studies show the benefits of taking the pill far outweigh the risks. Those benefits include protection against various cancers, pelvic and breast diseases.
Johns Hopkins researchers today reported the birth control pill is the most effective means of contraception and produces, quote, benefits much broader than originally thought. A researcher said it is now absolutely documented beyond any doubt that oral contraceptives have a protective effect against cancers of the uterus and ovaries. These findings, which were called unexpected, were based on the most recent studies of oral contraceptive use. The spokeswoman said some new analysis indicate risks associated with the pill may be limited to women over 35 who smoke. The cruel arithmetic of recession figures in a report released today by the Washington-based Food Research and Action Center. The report says that the steady decline in infant mortality in this country is now being reversed in cities and states hit by hard times. As Congress considers federal funding of basic health and nutrition programs, Steve Croft looks at policies which critics charge don't add up.
Baltimore City Hospital. A team of nurses fights to preserve the faint heartbeat of a 2-pound baby girl. For a decade now, better machines, better care, better nutrition have steadily reduced the infant mortality rate. But now, in some places, it's starting to go back up. It's starting to go back up in places where the recession has hit the hardest.
Apparently there is sufficient poverty now with this very major recession to actually have increases in the mortality rate.
It's not happening everywhere, but the infant mortality rate among whites in blue-collar Baltimore may be up as much as 30%. Michigan recorded its first significant increase since World War II, and in parts of Detroit, the infant mortality rate equals that of Honduras, the poorest country in Central America.
More controversy today about the study commission President Reagan has ordered to look into the problem of hunger in America. The panel members reportedly will include some critics of welfare and nutrition programs for the poor. A White House source is quoted today as saying that one potential appointee to the panel is Dr. George Graham of Johns Hopkins University. Dr. Graham told a Senate committee last spring that the nutritional status of our people, including low-income groups, is very good and continually getting better.
A new study on the evils of smoking shows that pregnant women who smoke may be damaging their children's potential to learn. The evidence comes from tests performed on rats. The study will be published in next week's Science magazine. Robert Hager explains.
Previous studies linked cigarette smoking by pregnant women to premature births, stillbirths, or underweight babies. Now, new animal tests suggest it could also cause learning problems for young children. Dr. Lawrence Fechter and a colleague at Johns Hopkins University in Baltimore subjected pregnant rats to very mild doses of carbon monoxide, a principal ingredient of cigarette smoke. After the rats gave birth, their month-old babies were put in boxes like this to learn. When the lights went on and a tone sounded, the baby rat had to run to the other side of the box, or it got a mild shock. Each baby was put through this exercise 200 times over 2 days. By the second day, the baby rats of mothers who inhaled carbon monoxide still hadn't learned to avoid the shock. They were getting shocked 73% of the time. Another group was getting shocked 87% of the time. But other groups of baby rats with mothers who did not inhale carbon monoxide learned better, managing to avoid the shock 50% of the time. Dr. Fechter repeated the experiment 5 times with different rats and got similar results.
They suggest to us that prenatal CO exposure, carbon monoxide exposure, may produce damage to the brain, leading to an intellectual impairment.
A recent government survey indicates about half those women who smoke now quit during pregnancy. If this animal work translates to the human experience, and doctors suspect it might, that would be still another incentive for even more to quit. Robert Hager, NBC News, Baltimore.
A potentially important story about the deadly disease AIDS. It involves a mystery that may become a hope. Some tests raise the possibility, repeat that word, possibility, that some people, it turns out, may have a natural ability to rid themselves of the AIDS virus. CBS News medical correspondent Susan Spencer has the story.
The longer someone is infected with the AIDS virus, the more likely that person is to actually get the disease, and no one is known ever to have recovered. Therefore, the interest in a bizarre discovery at Johns Hopkins, that 3 gay men in a study group of 5,000 who had tested positive now test negative for infection.
The tests were quite accurate, and in fact, we ruled out the possibility of laboratory mix-up. So it's not a laboratory error, and the test is a very sensitive and a specific test.
The 3 patients in question are part of a 4-city study designed to chart the progress of the disease. Participants are tested every 6 months. The question, could these unexpected results turn current ideas about AIDS upside down? Could it mean that there are some very few people whose bodies can beat the AIDS infection naturally? That might not mean much to the average patient right now, but such a finding could give AIDS researchers new avenues to explore.
Four people infected with AIDS created a stir last year when they appeared spontaneously to get well, but they didn't. And now that has generated new concern about the safety of this country's blood supply. George Strait reports.
The procedures commonly used to test the nation's blood supply and individuals for the AIDS virus may be missing thousands of infected persons. At a news conference today, researchers from Johns Hopkins University revealed the AIDS virus can hide and that an infected person may be able to infect others without ever testing positive for the disease.
This is an observation that we have seen only in those individuals who are in the earlier stages of infection.
The discovery was made while studying 4 men who initially tested positive for the AIDS virus. Then 6 months later, the same test showed them to be negative. They didn't suddenly get well. Instead, a third, new, more sensitive test discovered the virus was present but inactive. Researchers don't know why the virus becomes inactive, but it seems to be a situation that's rare, which is why experts are not now recommending that the entire blood supply be retested. George Strait, ABC News, Washington.
Federal health officials report today that the total number of AIDS cases in the United States has now passed the 50,000 mark. 400 new cases are being reported every week. At the same time, health officials announced that human tests of an AIDS vaccine are being expanded to 6 test sites around the country. Here is more from ABC's George Strait.
Major expansion of trials begun 3 months ago. Trials expanded because the new vaccine seems safe. In fact, it's passed its first big test. It has not had any harmful effects on the immune systems of the 30 volunteers tested so far. Like the other potential vaccines being developed to combat AIDS, this one is made from the outer coat of the AIDS virus. It's powerful enough to trigger immunity against the virus, but not so powerful as to give the person the disease. While excited by its promise and its performance so far, researchers say it will be at least 3 years before the experiments are finished.
The only way we can determine what the vaccine will do and whether or not it's safe is to test it in healthy human individuals. So it's a long step-by-step process.
So at least initially, the nation's billion-dollar investment in AIDS research seems to be paying dividends. And while progress is still measured in very small steps, it's progress all the same. George Strait, ABC News at the National Institutes of Health, Bethesda, Maryland.
It certainly says something about the difficulty of the struggle against AIDS that when an international conference on AIDS is held, like the one this week in Stockholm, we almost automatically expect the news to be bad. Well, today, scientists attending that conference turned their attention to efforts to find a vaccine to prevent AIDS. And as ABC's George Strait reports, this time the news was a little more encouraging.
The conference also heard results from experiments done in the U.S. with a different potential AIDS vaccine. Susan and Pat are among 60 volunteers who've received 2 injections in the last 4 months.
We were told to expect maybe some flu-like symptoms, but we haven't had any of that.
For now, the U.S. vaccine seems safe, and it does produce antibodies against the AIDS virus. But a key question remains unanswered.
We don't know yet whether these antibodies are of the functional capacity to neutralize the virus or block the virus from multiplying.
This is the 6th International AIDS Conference held here in San Francisco this week. there is an enormous hunger for information. 10,000 scientists, doctors, AIDS professionals from many parts of the world, more than 100 countries, and standing by at the Moscone Center, where the conference is being held, our medical correspondent, George Strait.
Well, what has people really excited this year as opposed to other years is good news about vaccines. For the first time ever, some progress. Brian McGuire has cells in his body that can fight off and kill the AIDS virus. Cells which potentially could protect him from ever getting AIDS.
And so I have white blood cells that will eat AIDS-infected cells in a test tube.
While the experiment is still in the test tube phase, the apparent protection came from this experimental vaccine made from selected parts of the AIDS virus.
They stimulate some of the cells in the vaccinated person to attack or target and kill the virus.
I know that this isn't going to be the ultimate vaccine, but at the same time, I feel like they really are coming up with some good information here, and so, you know, it is very exciting.
Another cause for excitement. Reports at the conference of success with a second experimental vaccine. Researchers gave it to chimpanzees in this lab and successfully protected the animals even after live AIDS virus was injected into them. The reason for the optimism here is that these experiments represent the first time scientists have been able to protect against the virus that causes AIDS in humans.
It's clearly possible. It may take some time to perfect things, but it's clearly possible.
Scientists are so pleased with the vaccine's potential to protect against becoming infected with AIDS, they are now testing them to see if they can work like drugs to cure people already infected. It's worked so far in 2 chimpanzees.
And they demonstrated that those 2 vaccinated chimpanzees cleared their infection and were able to resist re-exposure to the virus.
We have to underscore here that these are just preliminary experiments, but what makes them significant is that they are for the first time experiments of success, because all previous experiments with vaccines have been failures.
Another prediction today that the number of new AIDS cases in the U.S. may start leveling off within the next 5 years. It comes from a study at Johns Hopkins School of Public Health, which says the disease seems to be spreading at a slower rate, and people are getting better treatment for it.
Rather reporting. Good evening. Democratic presidential candidate Michael Dukakis made a strong bid today for the support of American working people. He proposed an ambitious new health insurance program that, for the first time, would insist that most employers provide their employees with medical benefits. Our coverage begins with CBS News chief political correspondent Bruce Morton.
Dukakis began his day at Herman Hospital in Houston, talking with some people who don't have health insurance. A few hours later at Western Kentucky University in Bowling Green, Dukakis outlined his health care proposal, so that when Americans get sick, he said, the first question they'd hear would be the one his doctor father used to ask.
The question that doctors and nurses ask every day, not how can you pay, but where does it hurt?
The millions of Americans with inadequate or no health insurance often work at part-time jobs for small companies in the service industries, the very sorts of jobs that have grown during the Reagan years. And not everyone realizes exactly how many people are uninsured.
Out of 250 million people? Well, I think some people don't have health insurance that can take care of their own needs, so I don't know the answer to it, no.
About 37 million, according to the statistic.
Bush hasn't said much more about health insurance, except that he wants more coverage made available through private plans and competition, not government involvement. His campaign today called Dukakis' idea socialized medicine, a prescription for financial disaster that would put the American economy in the hospital. But many health care advocates welcome the plan.
We know that about a third of the uninsured are children, and we're very concerned that these children are not getting a healthy start in life.
There will be debate over whether the Dukakis plan will work, whether business should pay more. But the Democrats think they have a winning idea here, one that clearly hits a nerve among voters. Susan Spencer, CBS News, Washington.
On Capitol Hill today, a House committee began investigating some of the problems facing older women in America. For a surprisingly large number of American women over the age of 65, life is lonely and difficult. Poverty often makes the problem worse. Here's ABC's Carol Simpson.
Today, the Select Committee on Aging learned from a recent report that while only 12% of men over age 65 live alone, 67% of women do. And of those women, 20% are living in poverty.
There can be little doubt that an income of less than $104 a week constitutes real deprivation, where hard choices among the necessities of food, shelter, and medical expenses are a daily reality.
There were recommendations that women like Mrs. Carter get higher benefit payments and improved medical protection. It was almost 2 years ago to the day that President Bush outlawed broccoli aboard Air Force One, angering farmers and nutritionists and parents everywhere when he explained why.
I do not like broccoli, and I haven't liked it since I was a little kid, and my mother made me eat it, and I'm President of the United States, and I'm not going to eat any more broccoli.
A new study out today indicates Mr. Bush is making a big mistake. ABC medical correspondent George Strait explains why.
Within this whirling mixture of green fluid may lie the answer to a question children have asked for years. Do I really have to eat my broccoli? Dr. Paul Talalay and his assistants at Johns Hopkins University say yes, because after more than 20 years of toil in this small laboratory, they think they have uncovered the secret to this malign vegetable, sulforaphane. It's a natural chemical found in broccoli that seems to protect cells from getting cancer.
We have found a very potent and highly selective compound that behaves as if it should be an anti-carcinogen.
Repeated studies have shown that people who eat green vegetables like broccoli get fewer cancers. The newly discovered chemical seems to be the reason why. The discovery has been published today in one of the nation's most prestigious scientific journals, so it is serious work, not some political gambit designed to embarrass the president, who still abhors broccoli. Although Dr. Talalay seems to think that broccoli could become an issue in this year's election.
The Democrats, of course, have not come out on this issue yet. Tongass, for whom I voted, looks like a broccoli man to me.
While touring a medical devices factory in Michigan, the president brushed off suggestions that he should now change his position on broccoli.
Mr. President, any reaction to the new Johns Hopkins study about broccoli?
But challenger Pat Buchanan, seeing a potential opening, lashed out at the president's intransigence on broccoli.
Well, I think that should probably be about Article 4 in the impeachment of George Bush.
So, do we really have to eat our broccoli? Probably yes, unless you are in a position where it is difficult for people to tell you what to do. George Strait, ABC News, Washington.
I like broccoli. That's World News Saturday. I'm Carol Simpson. Good night.
As for preventing the spread of AIDS, 2 new vaccines have shown some promising early results. In Amsterdam, here's ABC's George Strait.
Researchers say both vaccines should be ready for widespread testing in a few months. Each was made from different parts of the outside of the AIDS virus, and preliminary tests show each can produce enough of the right kind of antibodies to fight off HIV.
That's actually an encouraging step because it really means that this vaccine is more potent than previous vaccines that we've tested.
But the vaccines have been tested on only 36 volunteers. While the vaccines appear to be safe, until they are tested on hundreds of people who are at high risk, it will not be known if the vaccines prevent AIDS.
Troubling new findings tonight about that insidious internet threat. Websites promoting eating disorders and targeting young men and women. Researchers now say they have found 180 of these sites, and they've also discovered hidden ways fragile teens are recruited. Here's Lindsay Davis.
Visitors to these websites often call themselves Anna for anorexia or Mia for bulimia. And this is what they look like. Skinny, skeletal even. You can easily surf the web for pro-Anna or pro-Mia tips and how-tos.
These inspiration pictures are extreme, and the tips and suggestions that are being offered are also extreme, such as suggestions about how to go about purging.
Almost a decade ago, search engines like Yahoo and MSN were asked to shut these sites down. Authors of the study say they've gone underground. They take advantage of social networking sites like Twitter and Facebook. and they aren't hard to find.
One of the issues for many people suffering from eating disorders is that they feel like they're in isolation.
But online, they can find a community that encourages them to think thin. One website outrageously claims we view anorexia as a conscious lifestyle choice, not a disease.
You're winding up with a community that's encouraging and sanctioning very dangerous behaviors.
There's a fine line between slender and life-threatening anorexia. These harmful websites are designed to help tip that scale. Lindsay Davis, ABC News, New York.